Hey, my name is Dr. Jamin Brahmbhatt, and I'm a urologist and expert in men's health and wellness. Today we're going to talk about kidney stones. Now, I know more than most doctors about kidney stones, and that's because I've had one myself, and I've been through a lot of the stuff that we're going to talk about today. All right, so a kidney stone is essentially a calcification. It's a little piece of stone that is made in your kidney. Now, your kidney usually doesn't form stones. All these things can pass into your urine fairly easily, but if you got something that makes you prone to stones, then all these little things are going to come together and form a stone. Stones come in all different shapes and sizes. They can be really, really tiny, like a little grain of sand, or they can be big rocks inside of your kidney. All right, you got a kidney stone, what next? Well, this is when we offer you treatment options. One of the treatment options is actually do nothing. Just let it pass on its own. Or sometimes we can just watch it, but actually give you certain medications and certain recommendations to help you pass the stone. There are some awesome minimally invasive surgical options to treat your kidney stone. These include laser lithotripsy, where we essentially, without making any incisions, go through your urethra into your bladder and identify where the stone is blocking you. Then we take a teeny tiny laser fiber and turn that one stone into 1,000 small pieces. Those stones we can sometimes extract out using a little basket, or we just let your kidney naturally drain them out. The next option is extracorporeal shockwave lithotripsy, or ESWL. That's where you basically sit on this machine and externally through a machine that basically pounds on your back, we can send high intensity shock waves into that stone and try to see if we can fragment that stone using just that device. Let's say you have a big stone. A treatment option for a big stone is something called PCNL, percutaneous nephrolithotomy. That's actually where we make a teeny tiny keyhole incision into the back of your kidney, and through the back of your kidney we put instruments in that help us extract the stone. There's some really cool devices that we can use to extract the stone, but essentially we're all doing the same thing, where we make a little incision behind your kidney and take the stone out that way. All right, so you've gone through the surgery, you've gotten your stone out, but there's one thing, this elephant in the room that we all need to talk about, and that is a stent. So a stent is essentially a tube that goes from your kidney to your bladder. That tube is usually put in after any interventions for your stone. Actually, sometimes, just like it had to happen to me, because my stone was blocking me, they had to just put the tube in to drain my kidney first. So this tube can put in to help relieve your pain. The tube can also be put in afterwards to help you heal from the procedure that's done. It helps the stones, small stones pass, it helps the blood kind of evacuate, and helps your kidney just chill out and get back into its normal routine and give it some support while it's healing. That tube is generally taken out in the office within 30 seconds. So it's there, it hurts, it sucks. Honestly, for me, it hurt actually more than my kidney stone. But once you have it in, there's some really cool things we can give you in terms of medications to help you just kind of forget about it as best we can. All right, there you have it, the ABCs of kidney stones. And remember, my best advice is to stay hydrated, because that's what I've been doing ever since I got my stone, and I hope I never get one again.